Welcome to Vet NeuroJar, your source for the latest in veterinary neurology. Today, we're diving into a fascinating and challenging case report. Toxoplasmal Meningoencephalitis in a 14-week-old shelter cat, initially suspected of having feline infectious peritonitis. This report highlights the diagnostic difficulties associated with neurological disorders in cats and the importance of thorough diagnostic evaluations. The case. Our story begins with a 7-week-old domestic short-hair kitten surrendered to an animal shelter along with her mother and littermates. Upon arrival, she was underweight and had multiple external parasites. She received standard shelter treatment, including deworming and vaccinations, and tested negative for feline leukemia. After 2 weeks in foster care, she underwent an ovariohysterectomy and was adopted. However, a week after adoption, the kitten was returned to the shelter due to signs of distress. The adopter reported excessive vocalization, weakness, a need for more physical comfort, and decreased activity. The kitten also had inappropriate urination and defecation. A medical evaluation revealed weight loss, a slight fever, and oropharyngeal irritation. Although a viral upper respiratory infection was suspected, feline infectious peritonitis and other diseases were also considered. After supportive care, the kitten initially improved and was sent back to foster care. But at 15 weeks of age, she was again found to be febrile and lethargic. Blood tests indicated non-regenerative anemia, reactive lymphocytes, and elevated liver enzymes. Although results were inconclusive for feline infectious peritonitis, it was strongly suspected, along with a portosystemic shunt or toxoplasmosis. Due to her poor prognosis, the kitten was euthanized at 16 weeks of age. The diagnosis. Post-mortem examination revealed no evidence of feline coronavirus or feline infectious peritonitis. However, histopathological examination of the brain revealed disseminated necrotizing meningoencephalitis with bradyzoites and tachyzoites, indicative of Toxoplasma gondii infection. This was confirmed by PCR testing, which showed a 99% identity match to the T. gondii isolate TGSHIR 25 repeat region. Discussion. Toxoplasma gondii is an intracellular protozoan parasite that can infect all mammalian cells, with cats as the definitive host. Cats release the parasite into the environment. Clinical toxoplasmosis can be severe, especially in kittens infected transplacentally, leading to hepatitis, pneumonia, encephalitis, lethargy, and dyspnea. Diagnosing toxoplasmosis in cats is challenging, often requiring detection of parasitic stages in tissue. While increased IgM titers and a positive response to anti-T. gondii medications could suggest a diagnosis, definitive confirmation, especially in cerebral toxoplasmosis, requires identifying tachyzoites via histology and PCR testing. The prevalence of T. gondii is higher in feral cats due to their predation habits, typically affecting mature cats. However, this case in a 14-week-old kitten suggests alternative transmission routes, such as congenital transmission. The genetic similarity between the identified isolate and one from sheep brain highlights the adaptability of T. gondii across different hosts. Why this matters? This case underscores the importance of considering toxoplasmosis in cats with neurological signs, especially in shelter settings where feline coronavirus is prevalent. Differentiating between feline infectious peritonitis and toxoplasmosis is crucial, as misdiagnosis can lead to ineffective treatments. Advanced molecular diagnostic tools can aid in accurate diagnosis and differentiation. This case reminds us of the diagnostic challenges we face in veterinary medicine and the importance of staying informed about emerging diagnostic tools. By integrating these advancements into our practice, we can improve the management of feline diseases and ensure better outcomes for our patients. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.